Surgical oncology stands at the forefront of cancer management, offering a comprehensive approach to treating solid tumors and malignancies through surgical interventions. With a focus on eradicating cancer while prioritizing patient well-being, this field encompasses a spectrum of techniques, from minimally invasive procedures to intricate resections. In this enlightening guide, we'll delve into the latest advancements, evidence-based practices, and multidisciplinary strategies that define the dynamic realm of surgical oncology. Prostate cancer screening is a topic of debate, with the USPSTF suggesting personalized decision-making for men aged 55-69 and advising against screening for those 70 and older. It's vital to weigh potential benefits and harms carefully. For those choosing treatment, various androgen deprivation therapies exist, from surgical orchiectomy to LHRH agonists like leuprolide and adrenal-targeted agents like ketoconazole. These aim to suppress testosterone and restrain tumor growth. Treatment demands a tailored approach, considering factors like age, existing health conditions, patient preferences, and the balance of potential pros and cons. Shared decision-making between patients and healthcare providers is essential. Advancements in breast cancer surgery have ushered in a shift towards breast-conserving techniques like lumpectomy and partial mastectomy. These procedures prioritize tumor removal while preserving healthy breast tissue, often complemented by radiation therapy. Sentinel lymph node biopsy has emerged as the gold standard for assessing breast cancer spread to lymph nodes. This minimally invasive method helps gauge the necessity for extensive lymph node removal, thereby lowering the risk of complications like lymphedema. Oncoplastic surgery represents a fusion of tumor removal and immediate breast reconstruction, often utilizing the patient's tissue or implants. This holistic approach not only enhances cosmetic outcomes and patient satisfaction, but also upholds oncological standards. In the management of early-stage colorectal cancers, surgical resection remains the cornerstone of treatment. This may entail various approaches like colectomy, segmental resection, or local excision, tailored to the tumor's location and size. However, in advanced cases, more intricate procedures may be necessary, including multivisceral resections, pelvic exenterations, or cytoreductive surgery, paired with hyperthermic intraperitoneal chemotherapy, HIPEC. The rising adoption of laparoscopic and robotic-assisted techniques has revolutionized colorectal cancer surgeries, offering patients less invasive options. These advancements contribute to decreased postoperative discomfort, accelerated recovery times, and enhanced aesthetic results. In the realm of lung cancer management, surgical resection stands as the cornerstone for early-stage and localized tumors, typically involving procedures like lobectomy or pneumonectomy. The objective is to excise the tumor-bearing lung segment while preserving healthy lung tissue to the greatest extent possible. The advent of video-assisted thoracoscopic surgery, VATS, and robotic-assisted thoracic surgery, RATS, has heralded a new era in lung cancer surgery. These minimally invasive techniques offer advantages such as reduced surgical trauma, shorter hospital stays, and quicker recovery times, significantly benefiting patients. In cases of advanced stage lung cancers, a multidisciplinary approach is often warranted, combining surgical resection with chemotherapy and radiation therapy. This comprehensive strategy aims to optimize outcomes and mitigate the risk of recurrence. Furthermore, the integration of genomic profiling and targeted therapies has ushered in a personalized approach to lung cancer management. By tailoring surgical interventions to the specific molecular characteristics of the tumor, treatment decisions can be more precisely guided, leading to enhanced prospects for successful outcomes. In addressing liver cancer, surgical resection or hepatectomy stands as the primary curative treatment for patients with localized resectable tumors. During this procedure, the tumor-bearing portion of the liver is excised while preserving as much functional liver tissue as feasible. In cases where patients present with liver cirrhosis or unresectable tumors, liver transplantation emerges as a viable treatment avenue. This intricate procedure entails replacing the entire liver with a healthy donor organ, offering prospects for long-term survival. The adoption of laparoscopic and robotic assisted techniques has broadened the surgical landscape for liver cancer patients, presenting less invasive alternatives to traditional open surgery. These approaches contribute to reduced surgical trauma, expedited recovery times, and enhanced postoperative outcomes, ultimately improving the overall patient experience. In addressing gynecological cancers, surgical considerations vary depending on the specific type and stage of the disease. For uterine cancers like endometrial and cervical cancers, surgical management often involves procedures such as hysterectomy, lymph node dissection, and, in some instances, salpingo-oophorectomy, which entails removing the fallopian tubes and ovaries. In ovarian cancer cases, the standard surgical approach typically includes a combination of tumor debulking, omentectomy, removal of the omentum, and cytoreductive surgery aimed at removing as much visible disease as possible. The surgical treatment of vulvar and vaginal cancers may encompass partial or radical vulvectomy, vaginectomy, and lymph node dissection. The overarching goal is to excise the entire tumor while simultaneously striving to preserve function and achieve favorable cosmetic outcomes. Regarding cervical cancer, surgical options range from cone biopsy and trachelectomy, cervical removal, to radical hysterectomy, with the specific choice contingent upon factors such as tumor stage and location. The success of surgical oncology hinges on a multidisciplinary approach that integrates various elements. 1. Comprehensive expertise. Surgical oncologists must possess extensive knowledge and technical proficiency in performing intricate cancer surgeries, ranging from minimally invasive procedures to advanced techniques. 2. Collaborative care. Close cooperation with medical and radiation oncologists is essential to synchronize surgical interventions with systemic and targeted therapies, ensuring a cohesive treatment plan for patients. 3. Advanced imaging integration. The seamless incorporation of advanced imaging modalities like CT, MRI, and PT scans into surgical planning is crucial. These imaging techniques help guide surgical decision-making, ensuring precision and optimal outcomes. 4. Diverse team engagement. A diverse team of specialists, including pathologists, nurses, and rehabilitation professionals, plays a pivotal role in delivering holistic, patient-centered care. Their collective expertise contributes to comprehensive treatment strategies and supportive care throughout the patient's journey. By embracing this multidisciplinary approach, surgical oncologists can provide the highest standard of care, optimize treatment outcomes, and enhance the overall well-being of patients battling cancer.